with the other devices you have to pull back the scope, use your cup, flush, try and find the bleeding site, frequently by pushing the cup of the scope against the bleeding site so that you can cause some pressure on the bleeding site and so that the bleeding stops. Then you pull back the scope and continue to flush, and then the bleeding will start again. And then you have to apply very precisely your device, which can be the ESD device, ESD knife or device you're using, if it is suited for coagulation, or you use a coagulation forceps. So it takes time. Sometimes, of course, you have to change devices and use a coagulation forceps, and it takes time. Good thing of a microwave is that if you are cutting and the bleeding happens, you just immediately have to press the blue pedal, stay until you find the bleeding, don't move the speedboat, keep it there, put some pressure, and then press the blue pedal and complete the cycle, 4 seconds. And then, I usually, if it's a decent bleed, press twice the blue pedal, complete 2 cycles, and then you can pull back the speedboat and see if the bleeding is still happening. If the bleeding is still happening, then you have to be precise and identify the vessel in the way I described earlier. But otherwise, I think it's the only method I know with which you can treat somehow blindly with your device the bleeding site safely. And for me, that's extremely important, and it's the only device that with which hemostasis can be applied.